Ladies and gentlemen, the CDC is putting out BS numbers. Okay. This is the reason why we're getting told that we have COVID the most and die from it the most. But then every time we open up the papers, we see the obituaries loaded with elderly white people. And they got right in the obituary, they died of COVID. But we don't see all these black people. There's a reason for that, ladies and gentlemen. The truth. We haven't gotten the truth since we seen these people 500 years ago. We haven't gotten not one shred of truth from that point all the way up to now. Yeah, nobody should be shocked over this. So this is Politico. Subpoenas are necessary. House watchdog details extensive meddling with CDC COVID-19 reports. So remember they got caught fudging the numbers about black people? Well, it's far worse than that. So now this is December 21st, 2020. These people ain't no good. They can't keep track of numbers, y'all. They lie on the census. They lie on us every chance they could get. They lie on the COVID-19 reports. I mean, you can't trust these people with no damn number. That's why we've been 13% of the population for hundreds of years now, because you can't trust these people with no damn numbers. And that is a fact. House panel probing the Trump administration's coronavirus response released new documents detailing political appointees' extensive efforts to modify or scuttle scientific centers for disease control and prevention reports, as it also ordered up top Trump health officials to quickly provide documents. Trump appointees attempted to alter and block at least 13 scientific reports on the coronavirus outbreak surged across the spring and summer. Rep. Jim Clyburn, the chair of the House Select Subcommittee on Coronavirus, wrote on Monday a letter that was shared with Politico. Top officials at Health and Human Services and the CDC and prevention not only tolerated these efforts, but in some cases aided them, Clyburn added in his letter to HHS Secretary Alex Azar and CDC Director Robert Redfield. Clyburn issued subpoenas to Azar and Redfield, ordering them by December 30th to produce full and unredacted documents that Clyburn said the panel has sought for months. The panel probe into administration coronavirus response began in mid-September, shortly after a Politico story revealed how appointees meddled with the famed morbidity and mortality weekly reports, which are authored by career scientists and are typically free of political interference. In recent weeks, the panel released evidence alleging that Redfield ordered agency staff to delete an email that appeared to show political interference, and that a political advisor repeatedly advocated controversial herd mentality strategy regarding most public health experts as reckless. So Clyburn's subcommittee on Monday produced dozens of new documents detailing how Trump appointees, including then science advisor Paul Alexander, the department's top spokesperson, Michael Caputo, and other health department officials, worked to subvert the CDC's MMWR reports. So Trump and his team, and, they were fudging numbers, and the CDC pretty much went along with it. Well, these people ain't no good. They can't be trusted to run nothing. They really can't. You ain't going to ever get the truth as things remain as they do. You're never going to get no truth. There is no truth there. at all. All right. So, ladies and gentlemen, among the MMWRs that were targeted for edits, reports on the use of masks, the spread of COVID-19 in children, the virus transmission during the April 7th primary election in Milwaukee, and other reports that were seen as politically sensitive. Yeah, you remember the Tulsa rally that Trump had, that Herman Cain ended up dying, and Trump insisted he didn't get coronavirus from there. That's not where he got that. Oh, man. All right. So Trump appointees obtained the full text of a pending report. I got the draft about what the media was supposed to release. Then the CDC advisor, Nina Witkowski, and I remember when they were still pushing that malaria medicine, y'all. Y'all remember that? I think this was around those times when they were still pushing that. And you still got people running around here talking about that's a cure. That ain't hardly no cure. Y'all ain't curing COVID. Okay, let me just put that out there. Y'all ain't curing COVID. It ain't gonna happen. Given the importance of the select subcommittee investigation, the continued obstruction of the HHS subpoenas are necessary, Clyburn wrote. All right, so the House panel findings, HHS said it had pulled more than 1 million documents for the subcommittee probe, and that Alexander, who has since left the department, did not set strategy. While the administration is focused on vaccination shots, the subcommittee is focused on cheap shots to create headlines and mislead the American people, said HHS. HHS did not respond to question about whether the department would comply with the committee, and the CDC did not immediately respond to requests for comment. Alexander and Witkowski did not immediately respond to requests for comment. Caputo, who took medical leave the same day that Alexander left the department in September, has referred previous inquiries to HHS. According to new documents, Bill Hall, the top career civil servant in the HHS press shop, on June 5th, warned Alexander, Caputo, and other officials that they should not interfere with the MMWRs, compared with the CDC's flagship reports to a peer-reviewed journal akin, Journal of the American Medical Association. As long-standing policy, we do not engage in clearing scientific articles. And okay, so that's what Hall wrote. But the subcommittee documents revealed that political appointees instead kept trying to edit a series of internal and external reports. So in other words, they were trying to lie. They were trying to push lies. This is not the article we were shelving, Alexander wrote to Caputo, and that was on June 29th, about a pending CDC authored report. Wow. Why don't y'all just tell the truth? COVID is really bad. This herd mentality, it would take years and years and years to establish that. That is not something you would be able to establish right away. And a lot of people would get killed in the process. But, if you don't care about the numbers, you wouldn't care about the people either. But, that's why America's in the shape that it's in. We got too many uncaring people that are in charge. So, ladies and gentlemen, are we surprised that fudging is going on these reports, just straight up lying and changing numbers and changing figures to make COVID look less serious in the country? And of course, and blame the Black community for having the most and dying the most. But you know what, y'all? Every time they say that to you, open up the obituaries and you tell me who you see in there. I'm telling you, all I see are elderly white people. That's all I see. So if you see something different, give us the name of the publication and I'll post it if it's a lot of us dying, because we would need to know.